And we're back, everyone, with the Boston Congress of Public Health 40 Under 40 Public Health Catalyst Award Winners podcast. We have another guest with us today, Ashley Mayfaire, another 40 Under 40 BCPH winner for the inaugural class of 2022. And as you may know, the 40 Under 40 Public Health Catalyst Awards represents the next generation of leaders, entrepreneurs, researchers, scientists, activists, intellectual provocateurs, authors, and directors who are inspiring us and catalyzing us to a more just and equitable world. So let's all welcome Ashley Mayfaire to the show. Ashley, as the co-founder and director of the operations of Transsocial, let us know where you're calling in from, and then a little bit about your general background, and then dive into Transsocial because I'm incredibly interested in this venture.
Definitely. I am in Miami, Florida. It is very hot out. We are very warm. But I've lived in South Florida for the last 15 years, so live and work down here with the community. And I originally grew up in a little bit of the South and also in New England, and then ended up here back in Florida. And I have a degree in fine arts, which does not really come in handy much for the current work that I'm doing, other than making pretty event flyers. But I co-founded Transsocial with my husband, Morgan, when he began his transition from female to male. And we had a lot of trouble accessing services and resources for trans folks that need medical care, that need social support, legal assistance with name changes and things like that. And we founded an organization that was meant to be social, and it is very social, but it's also providing direct resources now. And we have some programs on HIV prevention and treatment, on name changes, on linkage to care for all kinds of specialties, as well as peer support groups and social events.
That's really awesome and amazing. So, can you tell us, like, Transsocial, is it? My sense is that it's one of a few organizations that exists like that. But I mean, tell me more. Like, how many others like yourself are in the country, and what is the state, I guess, of transgender individuals being able to access the different types of, as you said, medical care, financial, and some other things as they transition and beyond.
Well, we're definitely rare, but we're not we're not super rare. There's a few organizations in every state right now that are serving trans communities, and some of them are not formally organized into nonprofits like Transsocial. Some of them are more grassroots community groups, but there's definitely trans people doing the work all over the country. And we're actually working on a project to try to help connect more organizations like ours through a national network of providers. So we've made contacts in about 20 different states of trans-led organizations that do similar work to ours, to share best practices and try to reach out to more community and build that support network for nonprofit leaders as well as the community. Let's see, the state of the I guess because we're in Miami, trans folks are in a lot of danger right now because the state that we live in is starting to legislate away our rights, especially rights to accessing trans-affirming healthcare. We have a state legislature and a governor that's not friendly to the LGBTQ community and is actively trying to take away access to care. So we have to be really vigilant in making sure that we build deep relationships with trans-affirming providers, find alternative payment methods if insurances aren't going to cover different things, and try to organize our community to be able to advocate for our rights and to also help folks connect to resources when our rights are attacked.
Absolutely, and just getting more into that trans-affirming healthcare. I know that I attended a webinar a couple years ago about a group of ENT specialists or otolaryngologists who are conducting the surgeries so that trans men, if they want to be able to have a change in their voice, or trans women, they can actually do that type of surgery. And so I imagine that's like the sort of thing you're talking about, trans-affirming healthcare. But could you expound upon that a little bit more? What are some other examples for the audience to learn about what trans-affirming healthcare looks like, and what I would say trans-negating healthcare looks like, which unfortunately I feel which I think is unfortunately in more abundance than trans-affirming healthcare.
Absolutely. So I love that you brought up the vocal cord surgeries. There's also voice therapy from speech pathologists that can help people deepen and masculinize their voice and then raise the pitch and feminize the voice outside of surgery. There's also gender affirming hormone therapy is a medical intervention to help folks gender affirming surgeries and procedures, top surgeries, bottom surgeries, facial feminization, all those things should be available and accessible to trans folks. And the problems that we run into are insurance denials, saying that it's not medically necessary when we know that it is, as well as like a lack of cultural sensitivity with it from the healthcare providers, because everyone from the front desk all the way to the doctor need to know how to be an affirming space for trans people. That includes using chosen names if somebody hasn't had a legal name change yet, making sure that they use the correct pronouns, being able to navigate those conversations in an affirming way with their patients. All of those are components of trans affirming care. And a lot of places might have a doctor or two that is competent to provide the actual medical care, but their staff might not be culturally sensitive to providing a welcoming environment for the trans folks to even come in and access that kind of care. And what else can I say on that? I think for trans negating care, as you said, it would be not being affirmed with their chosen name or their pronouns when they're in a space, not seeing themselves reflected in materials in the waiting room, having folks kind of stumble over their language trying to address them correctly, as well as laws that are taking away coverage for these kind of transition related procedures, saying that they're not medically necessary or not proven to work. And there's plenty of science saying that they are. So yeah, it's becoming quite complex.
Wow, thank you so much for going into those details. It's always very interesting, like this whole process, and certain parts. I think if we're just using a U.S. lens, certain parts of the country are further ahead, right? I think than others. You were saying, Florida not looking so great, but I'd say places like Massachusetts just doing a little bit better in terms of that trans affirming healthcare. Transitioning just a little bit, but related to what you're saying, you teach cultural competency as well. What does that training look like? I myself am a physician, but I will tell you, beyond my own interest in wanting to provide, that affirming care for the entire LGBTQ community, I myself have not had any explicit training whatsoever. And I can say in medical school, I don't think we ever once talked about LGBTQ healthcare and how that might be different. But essentially, we're maybe given the opportunity to just wear like a rainbow sticker on our badges, but that is like, I think, the bottom of the barrel when it comes to being able to affirm.
Definitely. Yes, we work with a lot of med schools down here. Florida has, I think, 10 med schools, and we're in contact with most of them to help give some additional information to students, because they average about 1 hour during their entire med school career on LGBTQ topics in general. So we know that there's definitely a lack there. So we developed what we call a TLGBQ, cultural sensitivity course. We pull the T to the front because the trans community is often the most marginalized and overlooked. So we bring it to the front to bring attention to it. And we go into spaces and we give folks a deep dive into TLGBQ identities. So we go over terminology, lived experiences, common interactions based on the type of organization that we're training. And when we do medical offices, we do front office all the way to medical staff to make sure that every single person that's going to be interacting with that patient feels comfortable and confident that they can have a trans affirming engagement with their clients. And we also teach a little bit of history on the community. We talk about, we'll do some mock patients interactions where we have how to take a sexual health history, which is really important for HIV prevention and treatment work, how to talk about prior surgeries that a trans person might have in an affirming way. So we get pretty in depth to give folks all the tools that they need to provide affirming experiences for their clients.
I absolutely love that. And I, just as I said, thinking back to my own experience in medical school, we had standardized patients. And I'm just thinking about how, your type of curriculum could be nicely incorporated into that, because our patients who didn't really besides the fact that we were differentiating them based off of their health conditions, we didn't differentiate them otherwise. So even though we may have had a patient that walked in who was, obviously white or black or whatever, we actually never even um, paid attention to that. That was not part of it, right? And that's race, which we know can have significant implications for how one engages in the healthcare system. And so now, taking trans and lesbian, gay, and bisexual and other types of queer experiences into play, I can see how that could be very, very helpful. So I'm very excited by that in general. So tell me a little about your public health journey. I mean, I know we've gone into trans social. Was it just that your personal experience with your husband's transition that you got into this space, or were there other aspects of public health that you were maybe dabbling in before trans social came about?
Well, my husband's transition definitely pulled me into it, but I had always had an interest in kind of science and education and teaching and things like that. So it was a pretty natural fit, even though we knew nothing about running a nonprofit and doing public health work. But we were really embraced by the HIV prevention community here in South Florida and Broward and Miami, working in the work groups for like Latinos in Acción and the TIO work group and the different specialty populations that need extra cultural competency in their HIV prevention work. So we're part of the South Florida AIDS Network, and we've sat on multiple advisory councils and community advisory boards. And we just, as we learn more and more about the risk factors for trans folks for acquiring HIV, it became more and more of a focus in our work as part of taking care of the whole person. Their sexual health and their HIV status is just one aspect, but it's a very important one that we can wrap into all the other services that we offer.
Absolutely. And as we're talking, I'm just curious about, so you've done a lot of stuff domestically, with trans healthcare, and as well as other types of care. Internationally, what has your experience been? What does it look like, for the trans community in other parts of the world?
It varies, right? Like in some places it's illegal, or it's illegal to be LGBTQ or trans, and it could be punishable by death. And in other places, they have a lot more rights than we do here in the U.S. So it's definitely a mixed bag. We do interact with some other trans organizations in other parts of the world. We're working with some folks in Mexico. We try to reach some of the folks in South America. We've had a little bit of involvement with folks in Europe. So more around community organization building and making those connections. And it really comes through our clients. Because Miami is very international, we get a lot of clients that were born in other countries and need to update their identity documents from those other countries as part of the name change process. So we'll interact with different embassies and learn more about what it's like for trans folks in their countries. And sometimes folks are in other countries and reach out for resources, and we do a little digging and we try to connect them to something local that can help them. So little by little, as we've been doing the work over the past 5 or 6 years, we've been building up that network of connections across the world.
Absolutely. So I guess we can switch gears to inspiring moments. So Ashley, in your life and or career, with Transsocial or otherwise, are there some inspiring moments that you have that stick out to you?
I remember a few. I remember when I feel like it was, I'm trying to remember. It was one of the State of the Unions where I believe Obama mentioned the word transgender, and that was kind of feeling like trans people are finally being put on the map. And that's when we were first getting started in our work. And we always thought that we had to do a lot of big things in order to have an impact, grow and scale and do things on a national level. But the more we've done the work, the more we realize that local community connection and the individual connection to clients is what is making the change little by little. And I remember a few years ago, a client we had taken through the name change process sent us a handwritten card telling us how thankful they were for our help and how much we had kind of changed the course of their life. And we still have it because it gives us a lot of purpose, and it brings the joy into the work of knowing that we get to take part and help with people's transition and be an important part of their life for that step. And just being able to serve in that way has been really inspiring.
I love that. And I will say, very similarly as well, for the work that we do with BCPH, it's not necessarily, the bottom line, that we're looking at as affirming all that, although that's always nice. But yes, it is the small letters that you get, or just seeing that, you've had that contribution. I will also say, so challenging moments, actually, that you feel in life and or your career that may have been maybe at the time obviously difficult, but that may have been transformational and led you to where you are now.
Definitely. Well, I gotta tell you, with the current Florida state legislature, every day is a challenge because it keeps surprising us with new things. But I think starting a nonprofit from the ground up was a huge challenge. Morgan and I had no idea what we were doing. We learned everything from Google and YouTube. Luckily, there's a lot of folks sharing information on those platforms. But, incorporating and getting our 501c3 status, understanding how nonprofit accounting works, all the nitty gritty outside of providing the programming was a huge challenge that we've had to learn. But we've been able to actually help 3 other community groups become nonprofits because we had that knowledge, and we were able to, share our mistakes so that they didn't make the same ones, and support them as they went through the process, because there aren't enough support resources for small organizations to help them through that process. So if we can do it, we try to help.
Wow, that's great. And in helping those other nonprofit organizations, it's one of those things where it just people continue to pay it forward, or it propagates as well.
Yes, there's plenty of work to be done. We can't do it all, so there's room for everybody, definitely.
Absolutely. And with Transsocial, what are some things on the horizon? So I know some of the things that you guys have accomplished, but what are some things, like if you had a magic wand and your, organization was able to accomplish, some of these things, what would they be?
Well, we've definitely been pushing for meaningful participation of trans folks within all of these different public health processes here in Florida. So I would love to see more inclusion, less tokenism of trans folks here in Florida in all of the different planning bodies, and especially the research projects. And that's one of our first published study was about utilizing trans-led organizations to do research on our own community, and building the capacity of trans-led organizations and trans leaders to do the research and to serve their own communities. So definitely would love to see a push for that meaningful participation. And we're looking to expand our name change program to make it accessible throughout the state of Florida. We currently serve the state of Florida, but we're trying to grow the number of clients we can serve from a couple hundred to a few thousand a year by making strategic partnerships and streamlining the process with some help from some legal partners, and having a center. We're working with another group called the Mackenzie Project to try to create some trans space here in Miami that is unique and for our community.
I absolutely love that. And I wish you the best with those endeavors. I wanted to dive a little bit more deeply. So you mentioned the difference between inclusion versus tokenism. And I feel like this is something not just even particular, to when we're talking about transgender or transsexual individuals, but, any kind of person who's not the prototypical white straight male. So you kind of, let's go into depth about this for the audience, because I think people may think that they know what the difference is between including someone in the, in the conversation versus they're being just tokenized.
Mm-hmm. For sure. Well, I guess I can give examples. So, when we first started, there weren't a whole lot of trans folks that were out and open about their trans identity and, working in public health. So Morgan and I were asked to sit on a lot of boards, and there wasn't any actual engagement with us. It was just putting our name and our picture as a community advisory board member or something like that. And it took us a little while to figure out that they just needed some identities that fit a certain bill, instead of actually asking us what our community needed, what help we might need as a small nonprofit to grow. And that's how we learned the difference between being tokenized because we fit a certain checkbox that they needed as far as community involvement, versus being actually engaged in the work that was being done and asked what work our community needed to be done as well. And we've made better decisions and are part of other boards now that really want to invest in the community and create interventions that work as part of the research, and not just kind of from an outsider perspective, make reports on what's going on in the community, but never offer any resources to help. And also asking folks to make a commitment to growing new leadership. So it can't always be the same, rotating 5 people that are on these boards. We need to identify young leaders and mentor them and put them in positions on these boards so that we can grow the leadership down here, because there hasn't been a large investment in that. And that's reflective of tokenism as well. They don't want to invest in folks. They just want to have them there as a figure representing a community instead of investing in the community.
Wow, I think that's wonderful. That's powerful. I've had that conversation before, and I think that probably is the best explanation I've heard, of the tokenism versus inclusion, because I know I had a colleague where they were talking about how do we make sure that we don't just tokenize people. And I think you gave a perfect example of, well, what does tokenization look like? You're really just a figurehead, you're a picture, you're a bio, versus like you're an actual strategic, partner that you provide resources to, and that, you're humble and responsive to the fact that this group may know more than you do on
Exactly.
Yes, love it. So kind of a similar topic. So another thing that is thrown about a lot, I feel like, especially since the Black Lives Matter movement became even stronger, since George Floyd's murder and then the subsequent boycotts and riots that happened afterward, is the term performative allyship. And so when thinking about, the trans community, how can we all be, if we happen to actually be within the LGBT community ourselves, versus if we're not, how can we be better true allies as opposed to just engaging in performative allyship?
I'm really glad you asked that. My husband Morgan always says, like, get to know us, because the trans community is so varied. We come from all different backgrounds, all different races, ethnicities, genders, sexualities, socioeconomic backgrounds. Like, the only thing trans folks have in common sometimes is the fact that they're trans. So if you know one trans person, you definitely don't know them all. And definitely try to either volunteer with or engage with your local trans-led organizations or groups to get to know the community. And once you know about the community, you'll start caring. I forget who had said it, but I heard something about, like, you have to acknowledge the humanity of trans people and care about trans people. Like, that's your starting point. You got to come into this caring, because we can't teach you how to care about us. And then in your own social circles, in your own families, calling out transphobia and homophobia, correcting your language, correcting folks who misgender or dead name trans people when they're not in the room. That's a big one. Putting a little skin in the game. A social media post doesn't really change much, but donating and investing in trans leadership will. So trying to find more ways to directly support and engage with the trans community, as opposed to just, posting the trans flag during the month of November is a good place to start. But yeah, definitely get to know trans folks and start showing up. to different spaces and to different events to show your support, that's a good place to start.
I just love that. And the expression skin in the game, which I think it's the first time I've heard that expression when it comes to allyship, like what true allyship is. And yes, it's not just posting something on Facebook. And I will say, I'll ask. I won't lead. So, Pride, obviously, LGBTQ Pride has become, quite popular in many cities in the U.S. and the world as well. Is this something where people can go to learn more about the trans community as well, or is this potentially another example of just performative allyship?
Potentially. There are a few trans prides around the country that specifically work to provide resources and address the needs of the trans community within the larger LGBTQ pride celebrations. Morgan and I are part of Pride Fort Lauderdale, which is one of those. And it's a newer organization, part of the bigger Pride Fort Lauderdale umbrella. And we're still figuring out, what the best use of that space and that recognition is, because there is a tremendous amount of performative allyship or pink washing during the month of June, during Pride Month, where corporations that don't even have a trans affirming policy for their employees, have the march and the Pride parade. So we're doing our own thinking internally about how we hold partners and, bigger corporations accountable outside of 1 month a year when they want to support a Pride, and how we can leverage that for trans folks specifically, because they are often left out of the conversation. If folks want to learn more about trans organizations and trans leaders in their own cities or towns, I would say maybe start with their local Pride Center, LGBTQ Center, and see if they have any trans specific programming. You can find a lot on Google, surprisingly. And there's also a list that Trans Justice Funding Project puts out every year of all the grassroots organizations that they've funded. And there's hundreds. And you can find ones in your state that you can support as well. They usually have links to their websites and to more information. So there's more and more information out there, allowing you to connect to different trans-led groups. But Pride is great, and I love the visibility and the celebration of LGBTQ identities, but we don't have equal rights yet, so the fight isn't over, and we have to protest as much as we party, is what I will say.
Love that. Yes, absolutely. So not to get not to be confused that it's all a party, right, with Pride, but yes, absolutely, that things aren't secure. And then even with the most recent thing, the reversal of Roe v. Wade, and then the discussion, which might be at a murmur right now, not quite any louder than that, but the possibility of us going backwards in terms of trans rights that exist, and then other LGBTQ rights as well.
Mm-hmm. Yeah, for sure. I mean, we are very aware and on high alert for all of the laws that are coming, whether they're held up in court now or not. I think that there's definitely an agenda to come after LGBTQ rights across the country, starting with the southern states, which are much more vulnerable. And you see that they've started with trans folks, especially trans youth. Here in Florida, we have an athletic ban for trans youth. We have a ban on coverage for transition-related care under Medicaid coverage, which a lot of youth are covered under. So they're already chipping away at those rights for sure.
And Ashley, I was thinking about, how you provided training, and you said, all the way from administrators down to, the people who are having those more frontline interactions with transgender folks. What about curriculum in the schools, which I know is something that tends to be quite controversial, in K through 12, even for having, conversations about race and talking about, the history of slavery or otherwise. What are your thoughts about what the curriculum might look like for, K through 12, given these issues?
Well, in Florida, we also have the Stop Woke Act, which just went into effect July 1st. So it really limits what schools and employers can mandate as far as what is talked about in those environments. We actually are having to implement a waiver for our training. We're going to steer clear of mandating it from any employer that hires us to provide it. It'll be an opt-in to comply with that law, but it limits the truth that can be told, right, about history, about humanity, who exists in the world. We did a lot of engagement with GSAs at the different high schools down here in Miami for a long time, but I fear that those are also going to come under fire or be shut down under these laws. So we have to organize our community to be able to support trans youth outside of those systems and provide more community support for them and their families so that folks aren't as vulnerable as they're going to be.
Wow, that is just amazing. And you said like the Stop Woke campaign. In an ideal world, what would that curriculum look like, though?
In an ideal world, I would love.
Yes.
I mean, just an embrace of diversity, and there's so many great children's books about gender and sexuality, right? Like, the one about the two penguins, and there's just a lot of great. There's a lot of great work that's already been done, and those books are banned, and they're just shutting down all those representations of the community and people's families that have finally been out in the world, making people aware. So I guess in a perfect world, I'd want to see open conversations about diversity in humanity, about trans people, LGBT people, intersex people, all the different races and ethnicities, so that it's not something scary, it's just reality.
Absolutely. And I was thinking of asking you, a harder question, but I think you're a good question to ask. We may find ourselves just related to what you said, is skin in the game, right? So when you hear someone say something that's transphobic, and this can come from a colleague, it can come from a friend, it can come from a family member, what is your advice, when someone encounters, this sort of transphobic language, how to navigate that, especially given if there are certain power dynamics or just things that are in general hard to navigate. Plus, you throw on, trying to combat prejudicial beliefs and language.
That's a tough one, definitely. I mean, being clear and direct is always the best way to do it. And also, there's just a lack of knowledge and understanding in general. I think the statistic is like 9 out of 10 people know somebody who's LGBTQ, but only 3 out of 10 know somebody who's openly trans. So there's just an exposure level to the language and to the interactions that person might not have. So you can approach it with some curiosity, and just also tell them what is not okay. Say, if somebody's talking about, let's use the example of Caitlyn Jenner, right? People have difficulty navigating talking about her pre-transition, and you might hear them dead name her or misgender her, talking about the past, and just offering little constructive tips like, hey, you can still call her Caitlyn, even though you can say, when she was not presenting as Caitlyn or before she transitioned to Caitlyn or something like that, as opposed to using a dead name and misgendering them in the past, so that they can learn how to adjust their language in real time, and just encourage them to practice, and that, nobody gets it the first time, but it's important that we practice, affirming trans people when we're talking about them. And you can also get a little personal and say, I have a friend, or I have a family member, I love someone who is trans, and that kind of language really hurts when you use it. So I'd like you to change it. I'll help you change your language if you're open to that. So I guess that would be my recommendation.
Yes, I love that, Ashton. And I will say, I myself have been in that situation where I did exactly what you said, where like I have people that I love and I care about and who are good friends of mine, who are part of the trans community. And, same thing. And your use of the language is wrong. And I'm willing to be patient and help you with that. But I digress a little bit.
I mean, there's always going to be people that put their head in the sand, right? And we can't help them. But there's plenty of low hanging fruit of people that just don't know, and they're open to learning. And one of the things we always tell folks is when a trans person engages with you and corrects you on their name or their pronoun or something you're saying, it's because they want to keep you in their life, right? They want to have affirming interactions with you. They want to teach you the right things to say. If a trans person just ignores you and walks away, you're never going to see them again. They know that you're not a safe space. So being open to corrections is a good thing, and allow that without taking it as like a direct, criticism.
Right, absolutely. Which can be a barrier, for people wanting to defend themselves and their ego when they may have stepped in some quicksand when it comes to that.
It took me 6 months to fix my pronouns with Morgan because he transitioned after we were married. So it is when one person transitions, their whole family, friends, support network transitions with them. And everyone needs a little bit of grace during that process. It's not overnight. So don't beat yourself up, but don't beat up your allies either.
Absolutely. Yes, I love that. And I think that's it, just good advice for the person, who may be transitioning, because yes, especially if you've known someone as one kind of gender, just with the way the human brain works, like you have a certain pronoun fixed in your brain, not because you're trying to be disrespectful, but you're like, my brain just keeps spitting out this pronoun that I've known this person for 10, 20 some years. So
takes practice.
Yeah, absolutely. So Ashley, as a 40 under 40, Public Health Catalyst Award winner, has your life changed?
I would say it's definitely been humbling and also validating, because I never saw myself as like a public health contributor, other than in doing my little work, around the office helping people. So I feel like I'm part of a bigger shift in public health, and also getting to be in a cohort with other social justice leaders is really empowering. So I'm very excited.
I love that. And as I've been telling other people, part of the values of the Boston Congress of Public Health is having a very intersectional, multidimensional, multidisciplinary viewpoint of what public health is. And so, yes, oftentimes the work that we celebrate from, what we publish in HPHR Journal, to yourself and the other 40 under 40, are people who may not look like the typical bread and butter public health people that most people think of, but we're trying to change that conversation about what is public health, who is actually doing public health, who's making those significant contributions, and who can get into the field, and make that impact. I will say, as the last question, Ashley, where do you see the 40 under 40 cohort going, short term, long term, your cohort, and then future cohorts to come?
Oh my goodness. Short term, I'd love to. I can't wait to listen to all these and learn more about all the other folks in the 2022 cohort and what they're doing, and see what kind of intersections there are in our work and who I want to learn from. I hope we can get together at some point and share ideas and share successes and challenges, because I love learning with others in those kind of environments. And long term, I would love to see us gather around each other and support different initiatives that maybe need a little push here and there, because there's definitely strength in numbers, and having kind of those intersectional coalitions support different advances in public health would be really powerful.
I love that. Another expression. I'm gonna use intersectional coalitions. I'm a huge fan girl for like certain things. So I've been like taking notes of some of the things. Love that you said. So thank you so much, Ashley, for an awesome interview. For the audience, if you want to learn more about Ashley, please go to bcph.org 40 under 40 to learn all of the work that she is doing with Trans Social, as well as Go to HPHR at hphr.org to learn more about public health and social justice issues and to publish with us. Thank you again, Ashley.
Thank you so much. I appreciate it.